Welcome to video 3 of chapter 15. In this video, we will look at other threats to health and well-being, and we'll begin with sleep deficit. Children and adolescents need an adequate amount of sleep to support their physical and cognitive development, but many are getting less sleep than they did in the past. The statistic that your textbook presents is that only 9% of adolescents get the optimal amount of sleep per night, so less than 10%. And now the optimal amount of sleep is 9+ hours. It used to be always recommended that children and adolescents, older children and adolescents get 8+ hours, but newer research has confirmed that optimally 9 or more hours is the best. And so, once again, only 9% of adolescents get that amount of sleep per night. Sleep problems are associated with many serious consequences, including psychological, cognitive, and physical problems. Okay. Environmental toxins and threats. Children are more vulnerable, certainly, than adults to these because their neurological systems are still developing. And anything that's in the process of development is always more at risk than something that has completed development. Environmental hazards include, well, here's a whole list of asbestos, dioxin, household chemicals, lead, mercury, molds, pesticides, radon, and secondhand smoke. As it says here, lead interferes with cognitive functioning. In recent years, certainly the amount of lead that children are exposed to has certainly been decreased, and mainly due to a few major laws and that have caused changes in products that can contain lead. So we eliminated lead as an ingredient in household paint, for instance. Although it's still, older homes will still often have it, but newer homes, certainly, any newer homes will have to use paint that is lead free. This was one of the primary sources of lead ingestion, is that younger children would get little paint chips in their mouth from their walls, or they might be licking their walls or whatever, or even just touching their walls and then putting their fingers in the mouth, like it could give them exposure to lead. And we also have eliminated it in motor fuels, gasoline. I certainly remember growing up, the question every time you go to a gas station was, do you want leaded or unleaded? I mean, it was just, there was always two different pumps. If some cars liked leaded gas more, some liked unleaded gas, they were both being used. And finally they realized the dangers, because, it's not like children are ingesting gasoline, directly, but it is being put into the atmosphere as the car burns the leaded gasoline. So exposure to fumes from a car would contain small amounts of lead in them. So just to continue a little bit with that, so as I said, many older houses still have surfaces covered in old lead-based paint. And there's also, they find lead in the soil around, around homes that are near major roadways, particularly roadways that have been around for a long time, because the traffic always burned lead-based gasoline, and then the fumes would get into the air, they would soak into the soils near major roadways. And so children in urban areas, in city environments, and those that live in older homes have an increased risk of lead exposure. And you can still find lead in the dirt, close to major roadways that have existed for a long time. Okay, going on here, radiation and pesticides may be related to childhood cancers. And unfortunately, I mean, there are still pesticides being used today that uh, many studies have linked to to certain types of cancer. And the reason that they still exist and is that the evidence is not considered conclusive. Um, and so people that stand to benefit from using pesticides, cancer-causing pesticides, have pushed back against change, and if until there's kind of rock solid conclusive evidence, it's hard to put laws into place to effect change, and it's just because like the problem with gathering ironclad evidence is that the exposure to pesticides is it's going to cause a cancer years and decades afterwards. I mean, it's going to be an accumulation over years of eating foods that have been exposed to pesticides, and so it's really hard to link an eventual cancer at the age of 50 or something with a lifetime of eating foods that have been exposed to pesticides. It's hard to make that scientific link stick, but many studies do suggest that pesticides are still causing that pesticides are causing cancers. Um, okay. Um, Secondhand smoke and air pollutants. Obviously, these can contribute to an increased incidence of asthma. So, just like when I was talking about the lead, I mean, asthma is much more prevalent in urban city environments where there is more pollution. Okay, let's go on here. So, one interesting hypothesis is this hygiene hypothesis, which suggests that, as it says here, as our environment has become cleaner, it has lowered our exposure to germs, and as a result, our immune system is now less able to differentiate between harmful substances and less harmful irritants. And we certainly have a cleaner environment than ever before. We have so many, types of disinfectant products, and like the soap that you use on dishes. So you'll see on the label often like disinfecting and things, cleaners for household counters and for floors, and disinfecting this and disinfecting. I mean, there's so many products that are disinfecting our environments and eliminating germs, which overall is a good thing. But just like if you consider the way that vaccinations work, you expose a body to a little bit of of the of the disease, like in a sense, like so it will be a small amount, just enough to trigger your system to produce antibodies against that invading agent. So the COVID vaccine has a little bit of the a very small amount of the COVID virus embedded in the vaccine. So it the body gets exposed to it, says, "Oh, I don't like this," and it builds up antibodies to fight that, and eventually you get a immunity to that particular disease um, because you built up your antibodies against it. And this works the same way, like in childhood, the body kind of expects to be exposed to certain very small amounts of of germs, and in order for the immune system to properly build itself up over time. So it's actually a good thing that your young child might be sitting outside and put a little dirt in their mouth, for instance, or they're in a swimming pool and they swallow a little bit of germs from the water in the swimming pool. Or I mean, like these little bits of exposure help to build the immune system. So if a child was to grow up in a disinfected bubble, where they get exposed to no germs at all, they would have a very immature immune system by the time they get older, And this is what the hygiene hypothesis is suggesting. Maybe we've gone too far in eliminating exposure to germs, and that children need an adequate amount of germ exposure, believe it or not, to in order for their immune systems to develop normally and be functional. Okay. Um, let's look at accidents. You can see this from this chart here. Um, you know, we've certainly had serious declines, or like very good declines in the numbers of accidental deaths to children. Going back to this, what's it go back to here? About 1980 up to about 2012, and so you see, the number of accidental deaths has certainly decreased, and there's a number of reasons for this. If we were in a class situation, I'd ask you guys to come up with these things, but there's been a lot of really helpful, important laws passed during this time span here that have helped reduce childhood fatal injuries. Um, the number one and greatest contributor to decreasing accidental fatalities, and probably if you had time, you'd think about this, but it's the car restraint laws. I mean, they say nothing has made more of a difference. Um, like I was looking into it a little bit, and actual seatbelt laws um, for all passengers, I mean, didn't come into effect until 1984 in the States, and New York was the first state that introduced seatbelt laws in 1984. Like many common sense things, they were somewhat behind Canada. Canada started seatbelt laws in 1976 in Ontario, where I grew up, and I still remember, there was a lot of pushback against it, and I'm sure there was in the States as well by some drivers that thought they shouldn't get a ticket for choosing not to wear a seatbelt. But anyways, and so soon after, so I told you 1984 New York introduced seatbelt laws, and then it was 1985, actually the next year, that they came out with the first child passenger safety laws that, concerning car seats, and that children under a certain age had to be in a car seat. Before then, parents would sometimes carry their babies like in their laps, or while they're driving, and any kind of accident, I mean, that baby's going to be, could well be a fatality. I mean, it's obviously not safe just to be holding them in your lap, and so these car restraint safety laws were extremely important for protecting the youngest of children in car accidents, and the seatbelt laws in general help protect older children and teenagers from accidents, including adults. So that's really number one. They say. I'm going to mention a few other laws that have occurred. Bicycle safety laws have certainly helped. Having to wear a helmet while riding a bicycle. Um, uh, Having to put fences around pools. I don't know the exact year. At some point in the during this time span in this graph, they came up with the fencing laws, so that prevented a lot of accidental drownings. Uh, Flame-resistant clothing for children. And this is one thing most people haven't heard of, but there's a children's clothing has to pass a certain test to be, a certain level of flame resistant. So there's certain materials that can't be used for children's clothing if it catches fire too easily. So that's something I hadn't heard of for a long time. Flame resistant clothing. Also, government screening of children's toys. Finally, like, it stopped being that that a store could just like order a bunch of toys, let's say from some other country, like maybe made in China or something like that, and just go straight into the U.S. and straight to the shelves without being inspected. And at one time, that was just the way it was done, and there weren't standard inspections. Now they say that apparently all children's toys have to be inspected before they are sold, which makes a lot of sense. Make sure that they don't have lead paint and little pieces that they could suffocate, that they could choke on, and things like that. So these have all been useful laws to reduce the number of accidental deaths in children. Um, Here's another chart, and you can certainly see that the cause of fatal injuries, changes substantially depending on the age of the child. So it changes during development. And so if you look in the left bar, less than 1 year of age, by far the major accidental death is suffocation. As you go to 1 to 4 years of age, the most prominent accidental death is drowning, and that's usually with pools or bathtubs or something like that. Um, and then in every age afterwards, from 5 all the way up to 19, you can see that the major cause of death is motor vehicle traffic. And even with the reduction, with children in the cars having to be restrained and whatnot, that continues really throughout life as being the major cause of accidental deaths. So from 5 onwards. Um, okay. And finally, smoking, alcohol, and illicit drugs are also obviously threats. And, this is more so we're talking about teenagers here. So there have been certainly decreases in recent years. Adolescent smoking and alcohol consumption are at the lowest levels apparently in more than 40 years. So that's very positive. But still, alcohol remains the most used substance by adolescents. Marijuana is the most widely used illicit drug, although it's not going to be not really illicit anymore, at least in certain states. Um, and one of the problems, obviously, is when a child um, uh, gains an addiction to a drug and gets substance use disorder, and this is marked by cravings and use of more of the substance than intended because they feel a need for it and craving and a need for it. So they use it even when they don't necessarily even want it necessarily, because the body's asking for it and the brain's asking for it. It's marked by things like problems with peers at home, in school, risky use of the substance, even when teenagers knows it's causing problems in their lives. Once again, when you reach a certain point of addiction, you can't stop, even if you know it's bad for you and understand it. And the buildup of tolerance to the substance is the thing that causes the teenager to increase the levels that they're using. As tolerance builds up, this is common for humans to start using more of the substance to get the same feeling from it. One thing that I'll just mention here is, I did mention that alcohol and smoking and alcohol consumption are at lower levels than in the last 40 years. But one thing that has certainly increased in the last 10 years is teenagers' addictions to prescription drugs. This has been a rapidly expanding market. It's increased, substantially in the last 10 years. Most people have heard about things now. Like it's very common that drugs like Ritalin and Adderall are being distributed in high schools and in colleges. Um, and for people to use them, that for in terms of recreational use, to help them stay up, to help them study and things like that. So that has certainly increased and become more and more of a problem. As alcohol and marijuana or smoking behaviors have decreased, uh, prescription drugs have increased. And that will conclude video 3 in chapter 15.